child with severe choking becomes unresponsive, lower the child to a firm, flat surface. Shout for help, phone or have someone else phone 911, and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Repeat giving sets of 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, leave to phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions, until the child starts to respond or until someone with advanced training arrives and takes over. Choking is also a common emergency with infants. When an infant has severe choking, you need to act quickly. You'll use a combination of back slaps and chest thrust to help remove the object blocking the airway. Hold the infant face down on your forearm. Support the infant's head and jaw with your hand. Give up to 5 back slaps with the heel of your other hand between the infant's shoulder blades. If the object does not come out after 5 back slaps, turn the infant onto his back, supporting his head. Give up to 5 chest thrusts using 2 fingers of your other hand to push on the chest in the same place you pushed during CPR. Repeat giving 5 back slaps and 5 chest thrusts until the infant can breathe, cough, or cry, or until he becomes unresponsive. If the infant becomes unresponsive, do the following. Place the infant face up on a firm, flat surface, then shout for help. If someone comes to help, have that person phone 911 and get an AED. If you're alone and you have a cell phone, phone 911 and put it on speaker mode. Provide chest compressions in the same place as you would for CPR. After 30 compressions, open the airway and look in the mouth. If you see an object in the mouth, take it out. Give 2 breaths. Each time you give breaths, check the mouth for an object and remove it if you see it. Repeat giving sets of 30 compressions and 2 breaths. After 5 sets of 30 compressions and 2 breaths, if no one has come to help and you do not have a cell phone, then take the infant with you and phone 911 and get an AED. Use the AED as soon as it is available. Keep providing 30 compressions and 2 breaths, checking the mouth for an object after each set of compressions until the object comes out or the infant starts to respond or until someone with advanced training arrives and takes over. Give only back slaps and chest thrusts to an infant. Giving thrusts to the abdomen of an infant could cause serious harm. Any infant who has been given back slaps and chest thrusts should be seen by a healthcare provider as soon as possible. This concludes the section of our course on choking. To sum it up, you've learned the difference between mild and severe choking, how to help an adult, child, or infant with severe choking, and what to do if an adult, child, or infant becomes unresponsive when the choking is severe. It's important to act quickly because your actions can make a difference. Allergies are quite common, but if severe, an allergic reaction can quickly turn into a medical emergency. Symptoms of mild allergic reactions are stuffy nose, sneezing, itching around the eyes, itchy skin, or a rash. However, some reactions that seem mild can become severe within minutes. A number of things can cause a severe allergic reaction, including eggs, peanuts, chocolate, some medications, and insect bites and stings, especially bee stings. The signs of a severe allergic reaction are trouble breathing, swelling of the tongue and face, or signs of shock. An epinephrine autoinjector is a prescribed device that has medicine in it. The autoinjector will help a person with a severe allergic reaction breathe more easily. If a person has an epinephrine autoinjector, He will generally know how and when to use it. You may help give the person the injection if you have been trained and your state allows it. In a moment, you're going to practice using a spring-activated epinephrine pen. But first, we'll show you a demonstration of what you need to do during the practice. Pay close attention, because you'll be demonstrating the same steps to your instructor afterward. First, make sure the scene is safe. Phone or send someone to phone 911 and get the first aid kit and the AED. To use the epinephrine pen, follow the instructions on the pen and make sure you are holding the pen correctly. Hold the pen in your fist without touching either end, because the needle comes out of one end, and press the tip of the injector hard against the side of the person's thigh, about halfway between the hip and the knee. Give the injection through clothes or on bare skin. The legs should remain still while the needle is in place. Pull the pen straight out, making sure you don't put your fingers over the end that has been pressed against the person's thigh. Either the person getting the injection or the person giving the injection should rub the injection spot for about 10 seconds. Note the time of the injection and give the pen to paramedics for proper disposal. If the person doesn't get better, or if there is a delay greater than 10 minutes for advanced help to arrive, consider giving a second dose, if available. Okay, now it's your turn to practice using an epinephrine pen. While the video is paused, you'll pair up with a partner and take turns practicing, and then your instructor will test you afterward.